The Impact program has been around for the past almost 3 years now, and it's an integrated mobile police and crisis team. It's made up of, the team itself is made up of clinicians from Canadian Mental Health Association who are trained in mental health and addiction issues.
If you're required to attend a mental health call, our dispatchers will request a mental health impact worker to attend with us. Police will arrive and we'll make sure that the scene, and depending on the individual and the setting, is safe.
So we want to make sure that it's physically safe for everyone, and then we want to set up that ability to have a really honest and safe discussion and help people work through that crisis, de-escalate it, and find some options for people to be able to get what their needs met are.
If we can get that person resourced at the time, it's far better than having to go to the hospital, spending a few hours there, having the person admitted there, and then working out further down the road. But if we can deal with things at that time, it's far better off.
We can work with people, we can de-escalate, and we can get them to where they need to go to without really intrusive mechanisms.
The challenges around mental health and policing seem to cross with homelessness, mental health, and well-being.
Behind every kind of behavior are the layers underneath of it. So we see people with anxiety, depression, really feeling the impacts of social isolation through the pandemic.
And just in our everyday interactions, when we go into a home, maybe for from issues with families and children and parents, there may be some mental health involved there, some addiction issues there as well, or even simply a shoplifter, or a simple occurrence at a store or something like that. Mental health often plays a part in it.
Right now, we're only able to respond to about 50% of live calls from the police. And that's not because we don't want to respond, it's because we literally don't have enough funding to be able to staff the model to the needs of our community.
The patchwork is difficult for both the services and WRPS, but the actual individuals who require the services don't understand that in times of need, it doesn't matter if it's 2 o'clock in the morning or 12 o'clock in the afternoon, the need is still there.
Police have always been the go-to for mental health calls. And I would suggest that we do a very, very good job at addressing and dealing with a lot of the issues, but things are becoming more complex.
I believe that partnerships are the way of the future for both Waterloo Regional Police Service and other first responders.
I mean, we can't all do everything by ourselves, so to have those groups like the Canadian Health Association, the Impact members and things like that to work with us is great.
Right now our program operates from 8 in the morning until midnight. So, of course, mental health crises happen at all times of the day and night.
The more impact workers we have, the better, and we're looking to reorganize that whole approach, and where we're actually going to have maybe our officers riding with an impact worker in a car, going to calls. The officer may not look the way they look now, the way I'm dressed before you now, but maybe dressed down a little bit. But working together more hand in hand as opposed to waiting for an impact worker to arrive. We'll have them together and they can go together.
So we want to be able to respond to those calls in real time, overnight, and again, have that continuity of care and know that people are getting the right service at the right time for what their needs are.